So I'm representing Hofstra University, the School of Health Professions and Human Services, which I'm honored to be part of this school. And we have two degrees we're going to be talking about today, the Health Professions Education degree, which is an MSEd, and then the Health Professions Education Advanced Certificate. And I'll explain the difference, and I hope it will be clear. I am the program director of this program. And in addition, I'm Vice President of Faculty Development of Northwell Health System, and I'm an Associate Dean of Educational Skills Development at the Zucker School of Medicine of Hofstra Northwell. And I'm in 3 departments for that affiliation, Science Ed, Occupational Health, and Family Medicine. And of course, I'm an Adjunct Associate Professor at Hofstra University School of Health Professions. The website for the program is linked here, and you will get a copy of the PowerPoint after the presentation. So what's very nice for my role here, I'm affiliated with the medical school, I'm affiliated with the health system, and I'm also affiliated with Hofstra University that runs these degree programs. So I really cross the gamut of the necessary aspects to have a successful program. So one of the big questions I always get is who should apply to this program? And basically health professionals, and I do have some healthcare administrators in the program. I let them in on a one-on-one basis based on who they are, where they work, and what they want to do with their career. But this program is designed definitely for health professionals across all the professions, which there are many on a clinical teams. And those are people who teach in the clinical fields of expertise that they're in, or they oversee educational programs or desire to do that. They want to have a leadership role in healthcare education settings, or they want a career track as an educator and scholar in health professions education. So this is a very academic program, and it's very focused on the core skills of an academic life for a health professional. So the goals of the program are to be able for the participants, the students, to be able to plan and implement innovative education, but of course it should be evidence-based, this education. And that's very important because we look at the literature a lot in this program. We look at theoretical frameworks, should frame the education we do. So this is a very important piece of evidence-based health professions education. We also foster looking at the continuous quality improvement aspect of education. So when we talk in healthcare about continuous quality improvement, many times we talk about improving patient care, and we talk about improving clinical environments. Well, I'm talking about continuous quality improvement, so the educational environment is where it should be. Of course, effective teaching is a core skill of this program that you will get, and it will be based on evidence and new knowledge that you get. But effective teaching is very important, and where that happens varies in practice settings. It could be inpatient, it could be outpatient areas, it could be community-based. So it's versatile, the setting, but it's still effective teaching. And who the learners are they students? Are they trainees of some nature? Or are they faculty or adults working? Well, they're all adults, I should say, but students, trainees, and then full clinicians who need further teaching. The goal is to apply best practices to assessment and evaluation. We have a course focused on assessment and evaluation and what are the best practices, and that goes along with the quality improvement work that you always look at assessment and evaluation data. The next thing that's really important, a goal, is that people are able to develop the skills to lead education initiatives and programs. And leadership is a component of this program, and we have a focus on that, and I'll talk a little bit more with the capstone about that. And then the last thing that's dear to my heart, and I will say very important to me professionally, as well as the other faculty who work in this program with me, is at the end of this program, you can conduct a research project related to education and clinical work and disseminate that scholarship. I call it scholarship, not research, to the communities that you engage with professionally. And the dissemination could be as a publication, a presentation, or both. And so it's very important that you understand educational research, you apply it to something very personal to you or professionally important to you, and it goes back to the clinical learning environments in which you work. So I call this an applied degree. I don't know if that's a legal term, but I call it an applied degree because all the assignments and projects are drawn from the work the participants are already doing in their institutions. So in this applied science degree, you will use your experiences, and all the assignments and projects you do will relate to work that you want to do or are doing, and you could bring back to your settings. So this is not a program focused on test or finite knowledge testing with multiple choice questions or anything, even short essays. Everything course is project-based, and all the faculty give projects where you could self-select your audiences, who you engage with to do the project, and hopefully the project outcome, which counts, of course, towards your grade in a course, will go back to your clinical environments as useful. So I feel in a double dip situation here of doing work for your work world and doing work for your role as a student in this program. There are 5 content areas. I mentioned this a little with the goals. My goals are aligned with these 5 content areas that you could see in front of you: teaching and learning, curriculum development, evaluation and assessment, research methods, and leadership and management. There are 2 formal courses in leadership. There are 2 formal courses in research. There's 1 course in evaluation and assessment, 1 course on curriculum development, 1 course on teaching and learning, and then there's the final capstone project where you bring all this together into a form of scholarship, and I'll talk about that. What are some of the program highlights? And once again, I put the website here because you could see that there. We have very small classes. This is not a large program. I call this a niche program because it's not for everyone. It has a specific audience, and the classes are small. The classes are synchronous, even though it's an online program, which means we come together at the same time in a classroom online with our cameras on, and we're face-to-face on the computer. There is asynchronous learning also to get ready for class and after class, but each class has a weekly or a meeting, I'll go over the schedule in a minute, with synchronous time together. I am a big believer in online learning, but I feel there needs to be synchronous time. So this is not an asynchronous program. Asynchronous meaning no time together on the computer. You have a lot of contact with myself and the other faculty in the program. It's a very personalized program with a tremendous amount of mentoring, and you'll see data directly from participants from the past years. A brand new feature of the online program is a residency week, and I will describe that in a future slide. And the last piece, of course, is the scholarship that I mentioned. So what is the week in residence? I gave you 2 views here. We are in the Northeast, so we do get weather that looks like the bottom right picture, that's a wintry picture at Hofstra, and then a classroom picture at Hofstra, because we will be face-to-face for the week in residence, if possible. And I say if possible due to the current circumstances that we're in. And this will be a week in January that will meet from a Sunday to a Thursday. So it will be about 4 full days of meeting together during the day. So for people who are in work environments, would give you the week way ahead of time, and you would have to plan time away from your work environment to be in this program for that 1 week. There's 1 week in the first year and 1 week in the second year. So there's actually 2 weeks in residence required to complete the degree. So even if you do the program over 3 years, you would have 2 weeks in residence that are required. These are 0 credit weeks, so you don't pay for them, but you need to show up to get credit for them to complete the program. The content of those weeks will be based on current educational trends, so it's a flexible content and what I call hot topics that we need to be covering. A good example is the conversion of all learning over the past few months to online learning using enhanced technology would be a hot topic that would be very important to discuss in this resident week. So we will be very current, and we will be covering things that I feel are missing from the curriculum, that we touch on too lightly, and of course, anything that's very relevant at that moment. So that's filling the gaps. One of the most important things of this week is socialization and networking with peers in the program face-to-face. That's a very important piece, and that's why I have it face-to-face. So depending on how things go in the coming year, we'll have to make a decision about the possibility of the face-to-face. But socialization and networking are a big piece of this. We will have social events during this week that will allow people to get to know each other and be together. And peer support and peer learning is very, very big. In each of these weeks, we will address the capstone thesis project. In the first year, we'll address it from a point of development, and then second year, we'll address it from a point of completion. And this will include peer feedback on your capstone thesis project, which is very important, peer-to-peer feedback. So what is this capstone thesis that I keep referring to? This is a 6-credit culminating experience for all students. So it's 2 courses. There's a content and a process mentor. The content is an expert in your content of your thesis, since it's your thesis and your content. And the process mentor is one of the faculty who's core faculty in the master's program. It integrates all your knowledge and skills learned in your prior coursework to applied scholarly project. And scholarly is a key word there. So it's an original project designed by you under mentorship that you conduct, you evaluate, you assess, and you produce a scholarly paper that is ready for submission to a journal or a conference. You apply the research framework that you learn in the program, that's quantitative and qualitative design and educational theory. All that is applied as the research framework for your project. Very important. And once again, we want you to submit it to a journal of choice. We can't guarantee acceptance, but only submission. So it is 30 semester hours, the program, which is the least number of hours to have a master's degree in New York State. It's 10 courses. It's a cohort model. We hope that people come in as a cohort. If you do the program in 2 years, it's a cohort. If you decide to extend to 3 years, which some people have in the past, and some people are planning to do in the future, then your cohort overlaps 2 different cohorts. And that's for peer support and learning, and that's worked out fine to overlap 2 different cohorts. Once again, there's a 1-week annual residency week. The virtual course delivery is 2 courses per semester, but this can be adjusted to extend the program, where you could take 1 course a semester in the first year, and then most people double up in the second year. But if you want a slower start, you can start with 1 course per semester. It is an individualized schedule like that. And the courses meet in what I call an executive delivery model. So they meet for 4 hours, 7 to 8 times a semester on alternate weeks. So if you take 2 courses, you meet every other week with 1 course and every other week with the other course. And this allows you to have time to do the work because you have 2 weeks to complete an assignment for each course. So I call this an executive delivery model for people who are working and very busy. And also we're allowed to be more in depth in our content because we meet for 4 hours instead of the traditional 2 hours every week. The classes meet late afternoon, early evening, generally from 4:30 to 8:30. And of course, we give a break in that time. And the courses, once again, alternate. So they have the same day of the week and the same time. So when you need protected time from work, like for the fall semester, you know you need Wednesdays from 4:30 to 8:30 free. And in the spring, it might be Tuesday, 4:30 to 8:30 free. But it's always the same day in that semester that the courses alternate. So you're never in class on 2 different days in the week, which is very important for busy working people. There is one summer session that's important. It's a 5-week intensive. It's fully online, also 4:30 to 8:30, and it's an intensive course that's offered in the summer. And once again, the final thing is the capstone thesis project mentored with expertise in the subject area applicable to your role professionally and the content you're interested in. So this is the capstone project, so I'm not going to read these to you. This is the first cohort, my inaugural cohort, who graduated in 2018, and they did the program in 2 years. And this is the first cohort's thesis projects. You could see the diversity of projects here. I'm going to give you a minute to read these and really look at the diversity of topics that were covered. I'll answer any questions about any of these in the future as we talk for Q&A. These are the cohort 2 capstone projects and graduates. And you could see I had a diversity of people in this program. I had an EMT, I had this is medical lab science person, I had an MD, and I had a PhD in this program. So I had a very diverse class for cohort 2 that graduated in 2019. And you could see their projects reflect who they are. The third cohort just graduated in 2020. Unfortunately, we did not have a formal graduation, but we did graduate this cohort. And you could see the diversity in this. We had one nurse and then some MDDO doctors. And this is their project. So you could take a look at these projects. And I'd like to point out the project that is on the clinical practice management through a business of medicine curriculum. So some people choose to do projects very focused on pedagogy and curriculum, like family medicine curriculum, how to identify and address social determinants of health, or curriculum design for rheumatology fellows. But then other people decide to do projects more related to leadership. And that was true in all the cohorts. I did not mention that. You can gear your project, your final capstone thesis, to a curriculum area, a pedagogy teaching area, or a leadership area. As long as you use your research principles, I am okay. So if you're more interested in leadership, then you should focus your capstone, which is 6 credits, in the leadership area. If you're more interested in curriculum, you focus there. If teaching, you focus there. So it really depends on what you're interested in. So one of the most important questions for me is, would you recommend this program on the program evaluation, and why or why not? So this is examples from this past cohort of what they said about the program. And I'll give you a minute to read these. And honestly, all of them said yes. There was nobody who said no. I'm being perfectly honest. And I think their comments are very clear on what they got and why they would recommend this program. So I'll give you a minute to read this. I always ask them to give me an adjective to describe their personal and professional program experience. This is the 2020 adjective, and put into a word cloud. So this is really exciting for me. And the words that came out most were powerful, leadership, inspiring, and meta. Metacognition is a term we use in this program when we talk about learning, metacognitive processes. This is the 2019 adjective. And these are different words that came out: mentor, enlightening, innovative, self-discovery, motivation, effectual. So very, very exciting words for me to see what people thought about the program. If you want to hear testimonials, these are 3 graduates of the program. We have asked other people to give us testimonials. So if we have multi-professionals on this call, I'd like everybody to introduce themselves when we do the Q&A. These are 3 physicians. The person on the left is an internist. The person in the middle is a pediatric hem-onc palliative care doctor, and the person on the right is a internist as well. And these all these 3 people happen to work within Northwell, and I gave you the link to their testimonials. So what about the advanced certificate? The advanced certificate is basically a slice of the master's program. It's 15 credits or 5 courses. So it's exactly half of the master's program. There's no leadership content, and the capstone project is not research-based because there's no research courses. It is also a distance learning module. It is also synchronous, and there is, of course, asynchronous course activities. But once again, it's really focused on teaching and learning aspect of the program. You do a capstone project, but it doesn't have to be research-based. And you will also participate in 1 residency week. So it's a slice of the master's program, and you will get a graduate level advanced certificate, 15 credits with a transcript of a graduate certificate. And this is a registered graduate certificate. If you're interested in the program, I must say the application process is quite simple. You apply through hofstra.edu, grad apply. My application process is you have to produce a bachelor's degree, which we assume you have, with strong preference for an advanced degree in health professions if you have that. But as I said, on an individual basis, I review people. You only have to upload your terminal degree transcript, whatever that is, whatever your terminal degree, your last degree, not all your transcripts. I want a grade point average of 3.0, and I do want a written personal statement of your professional intent based on this program, because I only want people coming into this program that understand the intent of this niche program and where it could help you to advance your career professionally as a health professional or health care administrator. It's very important you submit a resume because I need to see your work history, your education history, the types of things you've done professionally to date. So this is very important, a resume. I don't require letters of reference because I meet everybody who's applying to the program, and I make my decision based on the documents I have as well as meeting. And when I say meeting, it's phone call or an online conversation at this point with the person who's applying. Very important for me to do that and make the decision that way. The tuition payment and assistance, there is a cost per credit, and it is, each course is 3 credits for the 30 credits, and the advanced certificate is 15. So you could check the bulletin for the tuition. Most human resources departments have tuition assistance that would benefit you, so you should contact your human resources representative. We do, for people who work in a hospital system, we give a scholarship of $1,000 for for students who work at a hospital and register for 6 credits in consecutive semesters. And then, of course, there's always student loans, and there's an inquire with financial aid office at Hofstra University. So that's important to consider contacting for student loans through financial aid. If you want additional information, I'd go to the website of the program. This is my contact information. I would use my email or my cell at this point, is the best way to get to me. And I'm pretty rapid on both of those. I do text if you want to text me, or you could email me.